Hi, would you like to get out and about in your neighborhood or community, but have trouble doing so because you have challenges maybe with getting dressed or bathing or finding transportation? Maybe there are other barriers you experience that make it hard to do daily activities. If so, you should know that Colorado's Medicaid program has services called Long-Term Services and Supports, or LTSS we call it for short. These services exist to help you if you have a chronic illness and/or disability, whether that disability is physical, psychological, or cognitive, as long as it prevents you from doing things that most other people can do easily. LTSS refers to a variety of services that are comparable to services a person might receive in a nursing home or at a hospital, but Colorado's Medicaid enables us to receive these services in our own homes or our communities, to help meet both of our medical and non-medical needs. If you apply for these services, you might even hear terms like nursing home level of care, but please don't worry. If you receive LTSS, that does not mean that you have to go to a nursing home, not even for a minute. Colorado's Medicaid agency and disability advocates are proud of our LTSS system because we want to make sure people stay in their homes and communities as long as they choose to. So with that clarification out of the way, let's focus on the information that I'm about to share with you about these amazing services. So this video will discuss who's eligible for LTSS. Then we'll tell you a little bit more about some of the tasks you can get assistance with through the Medicaid Long-Term Services and Support System. And finally, we'll share the steps you take to apply to get long-term services and supports in Colorado. So let's start with who can qualify to receive LTSS. To qualify, you must have a chronic illness or disability that prevents you from being able to care for yourself for long periods of time. Your disability may be visible, like mine is, but it may also be one that is not immediately visible, like a cognitive, neurological, or psychiatric disability. You can receive these services even if you're experiencing homelessness. If you're a college student or have to be in another state for a while for your job or any other reason, you can still stay on the program as long as your state of residence remains Colorado. There's also no age requirement to receive these services. They're available to all people who are eligible regardless of age. There are programs that are specific by age, but there's no age at which you can't get LTSS on Colorado. And then finally, you have to be on Colorado's Medicaid program to get the long-term services and supports. And you can get on Medicaid through PEAK, and there'll be a link to PEAK, your County Department of Human Services, or a Medicaid application assistance site. So now that we've discussed who may qualify, I'll give a brief overview of some of the many services a person may qualify to receive with LTSS. As I said at the start, LTSS provides valuable services to enable people to get out and about in our neighborhoods and communities. Perhaps you have doctor's appointments to help with your medical needs, but what about life outside of your health care? For example, everyone needs to take care of grocery shopping. Perhaps you're not sure how you'll get to the grocery store. Services can also be personal care to help with dressing or to help you get around town. Lots of people with disabilities need help keeping our homes clean due to either physical or mental disabilities. And all of the programs that we call waivers include homemaking as a benefit. Other people may struggle to make certain judgments or make decisions and might need help with that. Some people are compelled to harm themselves, or others have difficulty with self-control and managing aggressive behavior, which then leads to troubles with neighbors or landlords. Once again, LTSS can provide support to address issues like these and many, many more, all while keeping Coloradans with disabilities out of any kind of institution. Having heard about some of the many important services that are offered, you're probably wondering how you can get access to long-term services and supports. As I mentioned earlier, you have to receive Colorado's Medicaid as your health insurance provider. But if you're not already on Medicaid, start by applying to Medicaid. We've included links to the Medicaid application in both the English and Spanish descriptions below. If you're not sure of whether Medicaid's your insurance provider, we've included a link below that will help you find out if you're already on Medicaid. Again, if you have Medicare or other insurance, you can have Medicaid too, so don't let that stop you from applying. If you're already on Medicaid or have applied for Medicaid, the next step is to contact your local case management agency to ask about long-term services and supports. We've included a link in this description of the video to help you find your local case management agency and how to contact them. Your case management agency will then work with you to start an assessment process to determine whether you qualify for LTSS. The assessment process involves assessing, or determining, in other words, what kind of daily functional activities a person needs assistance with from a care provider, as well as how often they might need assistance and how much assistance they need to complete certain activities like the ones we've mentioned here, as well as many other everyday activities that we didn't talk about in this video. A caseworker will ask you questions that are designed to help gather information about your needs. You can answer these questions on your own or with the assistance of a guardian, parent, family member, friend, or with the help of an authorized representative of your choosing. To be clear, you have control over who gives information and input about your needs during the assessment process. When you undergo the assessment process, please be as open and honest and thorough as possible about the challenges you experience and the needs you have. The answers you provide to these questions will inform what Medicaid calls the level of care that you need, and the specific level of care determines whether you're eligible or not for long-term services and supports. After your assessment, your case management agency will look at the specific level of care you need to find out which waivers you may qualify for. In context, the term waiver simply means the type of additional services that you might qualify for on top of your regular Medicaid benefits. Each waiver program is targeted towards a specific disability type, and there are some waivers for children and others for adults. We've shared a lot of information here about what long-term services are and who may be eligible for long-term services and the process to qualify for these services. We know this might be overwhelming or confusing, but remember, there are resources to help you with this process. Please check out the links that we've included in this video description to find resources to help you. And remember that long-term services and supports truly improve our quality of life. When we get the support that we need, we have more freedom and independence to live our lives as we choose, with our families, our friends, and in our communities. Thank you so much for watching this video.